The Hypervolt is a great tool for CrossFit athletes to prepare before they train and also to recover when they're done. So what we're going to focus on are some key areas of the body. We're going to focus on the gastrocnemius, both the medial and the lateral side, and that's going to help improve dorsiflexion in the ankle so you can get down deep enough into your lifts. And we're also going to focus on the IT band, the adductors, and the deep hip rotators called the piriformis. And then we're going to move up to the upper body and work on the upper chest, so the pectoralis, and then the upper shoulder muscle called the trapezius. And then we're going to finish with the forearms because, again, with all the different lifting, those muscles get very, very tight, and we want to make sure that they're prepared and get to recover. So we're going to have Eli go ahead and demonstrate this for us, and we're going to start with the gastrocnemius. And what we want you to do is go up and down the inside of the calf, stay off of this bone right here called the tibia. So you want to stay in the meat of the muscle. And then once you find a tender point, we want you to go ahead and hold that for 30 seconds. And the reason we want you to hold that is that the vibration therapy itself, it will stimulate a receptor in the muscle. And once the vibration and pressure lasts for about 30 seconds, it causes relaxation, which then allows the tissue to stretch better. So again, we're going to do both calves, and then we're going to ask Eli to stand up, and we're going to have him turn around, and we're going to do the IT band. So we want you to go from the outside of the upper hip here, down the outside of the thigh. And again, if you find a tender point, we want you to go ahead and hold that. And key points here, stay off of the knee joint, stay off of the deep hip joint, and stay off the front of the hip bone. And again, we're going to do both IT bands. Then we're going to switch to the hamstring. And when you have that, think of the hamstring as a very big muscle, the back of the leg. So we're going to have him go on the outside hamstring first. And again, he's going to find any area of tenderness and hold it. Then we're going to have him go into the middle of the hamstring. Same thing, you're going to go up and down that tissue and find the tender point and hold. After we do the other hamstring, we're going to switch to his hip rotators. So you want to go, you have this hip bone, so you have the front and back of it, it's called the ilium. You want to go right in the center of that, and your piriformis muscle is deep in the hip. Find the tender point and get it to loosen up. And these are going to help you get into your lifts and get deep enough without putting stress on your knees, your hip joint, or your back. And we're going to have Eli sit back down, and we're going to move up now to the upper body. So we're going to move to his chest muscle, his pec. So we're going to get deep in the pec. A couple of key things here is you want to stay off this bone called the clavicle, and you want to stay off directly in here because your bicep tendon comes up into there. And so you want to stay off over here as well, which is your acromion. So just stay right in the muscle belly of the pectoralis. Same thing, find your tender points and hold. Then we're going to switch to his upper shoulder muscle. So he's going to get up into his upper trap. A couple of key things here again, stay off of the acromion, stay off your clavicle, stay off the cervical spine, and just get deep into the upper trap muscles. And these will be good tips for you to prepare yourself and then also help you to recover. Okay, now what we're going to do is switch, and we're going to go into this more of a flathead, and we're going to use this now on the deep forearm muscles. And this is important to help you prepare, but more importantly to help you recover after holding bars and dumbbells and doing pull-ups and other things. So we're going to have Eli go on the inside of the forearm here. So we're going to have Eli focus on going on the inside of the forearm, and what we want to do is stay off of the wrist bones, and we want to stay off of the elbow joint, and just going to be inside of the forearm, primarily in those deep flexor muscles. And again, if you find a tender point, you want to go ahead and hold that for 30 seconds.